was mainly the fact that I know that you saw a couple of my Canadian colleagues in South Korea when they did visit for the exosome. So
That's
we like
right.
to learn a little bit more on exosomes. We like to learn a little bit more about the PCL. Please tell us a little bit more about what you know about some of these products, Dr. Han.
Of these new collagen stimulators and the what we call new branch of medicine called regeneration. Actually, a lot has changed since the introduction of those two things. Collagen stimulators in the past were in powder form. So all the existing products were in powder form, and it had a microsphere, and we had to reconstitute, and we have to shake it really long time to prevent although we're actually to this new Korean company actually made is a fully liquefied version of polycaprolactone. Now I'm sure everyone, 90% of medical professionals don't know about this because this is the same thing in Australia. Australia is predominantly filler and toxin dependent, very heavily dependent in the past. So the last couple of years, my filler usage been down by 50 to 60%. The reason being, the clients were misinformed. We have so many, rogue injectors, and people give wrong informations, and that we had so many people had bad experience with the HA filler. So, I mean, HA filler, we still need them in certain places to give the volume and some structural component to our face. So I still use HA fillers, but very minimally. So as you know, the less is more, we use minimum amount. We still need the help of HA filler. Otherwise, we can't give volume back, instant volume back. But they don't know about these collagen stimulators and regenerative medicine. So I think it is important that we talk about these things as well. Collagen stimulators work by stimulating your body's own collagen. I call it collagen seeding. So by injecting these material under your skin, we're attracting the fibroblasts to produce collagen. In the past, the product has been mixed with CMC gel, and they're mostly in the powder form. So mixing is hard. To get the result is hard as well because it's very user dependent. It has to be injected in the right layer. And now, hence the introduction of the fully liquid version. So it comes in pre-filled syringe. It's quite white, clear liquid. But if you shine a light on it, you can see some light particle coming up. So it's actually a colloid. So by making a liquid, we actually got rid of the dispersion of the particles are very wide, so we don't get that nodule formation. And I've had no vascular obstruction either. I probably injected maybe a couple of clients intravascularly when I was using needle technique with the liquid polycaprolactone, but there's no vascular obstruction. Okay. So basically, you can sleep well at nighttime. As you know, if you do a lot of HA fillers on the day, we can't sleep very well at nighttime, thinking about those nightmare vascular obstructive events. So actually moving away from fillers and slowly getting into the collagen stimulators, I'm actually sleeping well at nighttime. Although your client needs to be re-educated because people are so used to seeing an instant result, instant volumizing result from HA fillers. So that's the only difficulty that I faced when I introduced these new collagen stimulators and these medicine because people are not educated. So once they're educated, it's a slow result over 2 to 3 months. So you have to be patient as well. So a lot of people these days are not patient. So and because they were so used to HA filler giving instant volumizing result, initially I had issues adjusting to that, but all my clients over 1 to 2 years, they know why the importance of a natural result by using our own collagen to give a natural, long-lasting result. So I think this is the main thing. that people will need to know. And the exosome is another thing. Exosome, I tell my clients, it's hard to explain. For when I heard the concept of exosome, I actually didn't understand completely. But as I use more and more, which I do a lot of cases, I start to see what the exosome does. The main thing that actually changed in my clinic being exosome is it's completely induced PI-HPIE clients. It's actually completely changed my protocols.
Okay.
And yeah, and basically scar management, it's completely changed that too. Because the regenerative property, reepithelialization property of this exosome is so potent. At the moment, I can't live without in my clinic.
Now, in Australia, do you have the indication to inject it as well?
No, of course not. Of
I
course
see.
not. All over the world, unfortunately, it's off label.
Yeah.
But as you know, a lot of people, it's controversial whether a lot of people say, microneedling, these topical agent, give similar result to
Yeah.
like intradermal injection. But, I truly believe it's not. In certain indications, it can give you microneedling and combining with treatment into channeling, you can get completely different result. For example, if I need to treat my client, which I need to give you a therapeutic result, it has to be off-label injected, which will give you much stronger result. If someone's looking for like a skin rejuvenation result, I'm sure microneedling and exosome still works as good, but they give you different results. So I think this is controversial if I say which one's better. It will create a lot of issues. So I wouldn't mention further, but in some cases I do off-label injections. In some cases I still do microneedling, but most cases you really appreciate the power of regenerative medicine when you combine with the devices.
Now,
Because so I tell my clients,
oh, sorry about that.
more
Yeah.
damage you have initially, you get better result with the exosome. So by combining the EED and sorting our client's skin, right? And through the accelerated healing process of the exosome, we're actually getting better result. We're not getting one result by doing EBD and exosome. We're getting 3 results instead of 2. So I actually try to combine a lot of my procedure with the exosome in my clinic.
I see. Yeah. I mean, we try to do a lot of combination treatments in our patients as well. And one question that I had for you, because the bioregenerative, a lot of people have this idea that, some of our older patients or more mature patients have less regenerative capabilities compared to some of our younger patients. Now, in your practice, would you say some of your younger patients have noticed more results or longer term results
Definitely.
compared to some older?
Older they said the sources from very young, healthy people in the 20s and 30s. Technically, it's actually dosage dependent result. For example, with hair, I don't actually use 1 ampule for the hair. I actually use 2 ampules. And instead of mixing 5 mils, I use 3 mils and give a more concentrated exosome per area. So I almost always, first couple of sessions, use 2 to 3 vials instead of 1 vial in one area. Same with the collagen stimulators. More per area, you get better result. And as I treat more older clients, I need more session to achieve the similar result as with the younger clients. So that's for sure,
And I'm
100%.
assuming
It's
it
age
takes you a little
dependent.
bit more time as well for some of your more mature patients.
That's right. So people in their 20s, probably in their 30s, usually I get really significant result even after one session, couple of weeks, and the result peaks at 2 to 3 weeks. And you see as older mid-age and older people, we're seeing less results. So I need to build up more of the exosome and collagen stimulator into my clients before I'm seeing my satisfactory results.
I see. I see. Yeah. So I've been noticing that as well in my patients and some of my older or more mature patients. They have a lot of difficulty even understanding the bioregenerative medicine on its own. a lot of people these days, especially with Amazon, especially with how things fast are moving, they need the results yesterday type of thing. So there's a lot of education that we need to do in terms of medical professionals, and I certainly agree with you. And that's why,
Mm-hmm.
and hence why we're having this session today to talk a little bit more about some of these injectables. And one question that I
Mm-hmm.
had for you was sort of comparing the different types of polymers that are out there on the market. Now we have the PLLA, there's the PCL. Are there any other ones that are available on the market that you know of that are pretty popular?
Sure. For me to classify any product as a collagen stimulators, it has to meet few things. It has to produce a significant amount of strong neocollagenesis effect, and it has to be sustainable. We can't be doing collagen stimulators monthly, right? I wouldn't call it a collagen stimulators. Some companies even state that HA materials are collagen stimulating. It does to some extent, but they don't last long enough in your system to be stimulating long
Agreed.
enough. And you can't
Exactly.
be, yes, exactly. So for me to classify collagen stimulators, it's usually high polymer material, and they usually start with P.
Yes, absolutely, absolutely. Yeah. So we know of the PLLA and then we know of the PCL.
Yeah. In
Any other ones?
terms of strength,
Oh,
oh, in terms of strength, as this is already assigned A, and then one after that is PDLLA.
mm,
And one after that, oh, there's so many you can call PDO. There's liquefied PDO these days as well. And then, you go down further, the result goes down as well. And the KAHA belongs to, I think, a little bit further down in the track in terms of strength of collagenesis. So let me explain the polycaprolectone. People know PCL is like Elan said. That's the most common question asked me. Is PCL Elanse, Guri? What's the difference?
mhm.
Um, everyone think Guri is a liquefied version of the Elanse, which is completely not true. Okay, for someone to say, let's say CMC gel. So Elanse is a collagen stimulating filler. So when we inject that 1 ml of Elanse, which is PCL, 21% PCL plus CMC gel, you get that instant volume. So you get 1 ml worth of volume instantly. And as the CMC disappears over the next 3 to 4 weeks, that PCL microspheres start to stimulate the collagen where it's been injected. And slowly, actually, you get a dip in the volume as the CMC gel disappears, and the PCL microsphere takes time to give the volume back with your own collagen. That's why Elanse is very popular in Asian countries. The reason being, it can replace HA filler.
Mm,
HA filler, once you inject, water goes in and you get a bloated, overfilled look. Whereas the collagen stimulated fillers, you get the filling result and followed by the tightening result from the collagenesis. So
yeah.
your face actually looks smaller after a while, not goes wider.
Mm,
And it also lasts long. There's also pros and cons with that because it's because it's not a HA material, we can't dissolve it. And there's
mm,
also issue with the nodules, and there's also issue with overstimulation, with swellings, redness, and also vascular obstructive event because of the CMC component. Now, Guri is completely different. Guri is the only liquid product, which doesn't cause nodules and vascular obstruction. And it doesn't cause volumization. It actually causes even neocollagenesis effect throughout your skin surface with minimal lines. Because it being liquid, spreadability is very great.
mm.
So we only need 3 to 4 lines to get a full face dermal thickening result. So
Wow.
that's the main difference. Uh, we want the even skin thickening throughout the whole face, not more thickness in one area, less thickness in one area. So that's
Mm.
the main difference between the CMC plus PCL, which is Lance, and with the Guri, which is just a fully liquid version.
Exactly. Yeah. And I think it's important that patients also understand the difference between the two products because
Hmm.
one does provide that more filler effect versus the other
That's
one
right.
is more of the, the injectable biostimulator at that point.
Mm.
Now, in terms of duration of some products, have you noticed some polymers creating more duration of products than others, or would you say they're generally relatively comparable in terms of duration, or are there some of them that really don't last as long?
Uh, um, as I said, PCL, and then as the particles get smaller, and if the particle, it depends on the particle size. It all depends on the product property, the particle
Mm,
property. So
mm,
it depends on how fast it breaks down. So it depends on the size of the particle. It depends on the shape of the particle. But generally, PCL gives you strongest, longest lasting result, and then followed by PLLA, and then PDLLA, and then
mm,
PDO, CAHA, etc., etc.
I see.
And the reason being, the CAHA is funny thing. All the biostimulator applies same. Radius, for example, you can use it as a filler. You can also use, if you dilute it long
Yeah,
enough, you can use it as a biostimulator. So,
absolutely. Yeah.
so it's all about dilution as well. And more you dilute, you decrease the result, but increases the nodule formation
Hmm.
with this non-liquid high polymer materials.
Yeah, I think nodules was also one of the big concern when
So that's
injectors first started
what's
using it.
happening. Hmm.
And one thing that we have noticed is that because some of these nodules could be sometimes even delayed, how have you
Hmm.
managed some of the nodules? Like, I don't know if you've even seen any nodules in your practice, Dr. Han, but if ever you saw one of the nodules, maybe a couple of months after, how would you sort of manage that with the patient? Are you using saline? Are you using any other products to dissolve it?
Now, since I started using the liquid PCL, which is Gori, never seen a nodule, so I don't have to deal with any nodule issues. But I still get sent a lot of client with the nodules from other clinics, people who had Elance, people who had Sculptra, even
Yeah.
Radius. Yeah, yeah. So I get sent by them. It's hard to treat, but usually, I don't know whether normal saline works after the all the collagenesis happened because it's not the line didn't help much. We may just dilute it long enough a little bit to soften that area, but really we have to wait until that collagen completely disappears. So really the treatment could be just a mainly steroid, isn't it?
I see.
Or surgical removal.
Or
Yes.
surgical removal. Yeah. So we did have a patient that did come to our clinic after getting, I believe, some sculpture injections. And either it's a delayed nodule, or it might have been an accumulation of the product, but it's clearly palpable and it's especially at the jowl area of the patient. And we do have an ultrasound into our clinic, and we did take a look at it, and just seems very in this when I took a look at it, it seemed when I took a look at it, hyperechoic on ultrasound. Now, I don't know if you played with any of the ultrasounds at all. Are you able to see any of these polymers on ultrasound at all? And what does it generally look like?
I actually didn't have had a look at the ultrasound result because I mean, I never, to be honest, I never experienced much of a nodule, especially when I was using previous existing products
Mm,
such as Sculptra Radius. So I didn't really had to get into that pathway, but certainly since I'm using more of a Gori, certainly I'm not seeing any of it. So I wouldn't have much experience with the ultrasound result of those nodules.
I see. I see. Yeah. So we just started playing with the ultrasound, and when we first started using it, it was just very interesting just for every one of our injectable patients to just take a look under ultrasound just to see what it kind of looked like. I mean, ultrasound is still a whole other topic. We're not going to get into that today. But another question that I think a lot of patients would like to have is in terms of the price point. Now, that's one of the discussions that we sometimes discuss about, but that's one of those sort of like touchy subjects. I know in Australia versus in Canada, I know the pricing is, I would say, relatively similar. When I went to Sydney, and even in some other city in Australia, the prices seem relatively similar to the Canadian prices, at least. Now, for the patients who are
Mm.
interested in getting, maybe Guri injectables, where would you sort of play the price point? And should we even sort of discuss about the price point like we discuss our botulinum toxin and our fillers, because it's not the exact same type of product that we're injecting?
Um, Now, we actually did some clinical cases last year in Thailand with in Siraj Hospital. What we found is one session of Gori result is actually more than 3 sessions of existing products. So even with the Gori, they recommend 1 session every 3 months. What I've noticed with my client, after single session, the result is so huge that I really don't need to go for second and third. So the pricing to change, if the clinic was used to getting clients to do monthly treatments, I think they will find it hard to change them into the new product, because so I also feel that whatever my client is paying for has to match the result. So stronger, better result with good safety profile has to be charged more. But I believe with the Gori, 1 mil price on average is around $500 to $600. So
Okay.
that's what I'm charging in my clinic. So, and usually 2 mil, I just need 2 mil for the whole face, 2 mil for the whole neck.
Yeah.
That's right. 2 mil for the whole face and 2 mil for the whole neck. And then because the result is still very strong, even after first session. So I'm probably seeing 90% of result if you, with the first session, and second and third, I'm seeing very small result.
Oh, okay. And have you had any patients that were so satisfied after their first result, they were like, you know what, Dr. Han, I don't even want the second one. I don't even want the third one.
That's right. So what I noticed, like this client, before I started this client on Gori, she used to come every 3 to 4 months for a toxin and some fillers. Now, when I tried her on Gori, she actually didn't call me. She didn't come back for a year, which was very, very unusual. So I thought I did something wrong. So when she actually came after 1 year, she said she didn't need to come in. So after 12 months, it was mostly broken down and disappeared out of the system. You do need to continuously slightly stimulate your collagen. So I call it, I use the word a lot of collagen banking. So rather than doing every 12 months, so I try to do every my clients 1 session every 6 to 12 months as a maintenance.
Yeah, we also do that in our clinic as well, as we really try and stimulate the collagen as much as possible. And our way of looking at it is trying to maintain their appearance for as long as possible by collagen banking, actually. So if your levels of collagen are higher now,
That's right.
well, over time, you're expected to lose some anyways, but at least you're able to slow down that process if you're boosting your collagen ever so often. So just like going to the gym, just like our nutrition, just like all of our other lifestyle factors, there's quite a bit of maintenance that's still required, just like anything else, if you want to maintain something.
And more into his collagen stimulator, especially Gori and the regenerative medicine, is since the introduction of these two new branch of medicine, my laser clients actually reduced as well. Because what I found, and more study needs to be done, is once I started, so I've got a Vizia, I've done 50 people, I've done 50 people, done Gori, 1 session, 1 month follow-up. What I noticed on the Vizia is that minimum 40 to 50% reduction in the pores, skin texture, rosacea, and hyperpigmentation, especially the PIH.
Yes, that was the question that I had to ask for you, was regarding the pigmentation. Now, a lot of, there's a lot of, polynucleotides, people talking about polynucleotides helping with hyperpigmentation, but I did hear as well that some of our biostimulators also have improvement in hyperpigmentation. Have you noticed even some patients noticing some noticeable results from their pigments, especially Asian patients?
Exactly. And especially if it's PIH, more for PIH result, I get great result. Like even laser resistant PIH cases, I can easily fix with the Gori now. So what I do, also because the Regeneron and those polynucleotides and exosomes are giving these similar results. If I do, whenever my clients, like 90% of my clients get collagen stimulators and the regenerative medicine, by doing those two, a lot of medical problems that you used to have on your skin gets fixed. So even we don't even need to get to the laser EBDs. So by doing the collagen stimulators and combining with the regenerative medicines such as exosome, and I get so much result before I start on my clients on my laser. So also my laser has reduced, but as I told you, combining more different modalities of treatment gives you better results. So it has to be individualized. Everyone needs a different treatment. Some people don't like laser because they've also already experienced side effects from the laser. So this is something that we can offer to alternative treatment option that we can offer to my clients. But certainly, I wouldn't say to my client, oh, if you have melasma, I'll do collagen stimulators. So it doesn't equal collagen stimulators. You can say that this is mainly for neocollagenesis effect, for skin tightening by building up your collagen, but you can also see improvement with these things. So I wouldn't use this solely as a treatment option for those indications.
Absolutely. Yeah. But I think also having a complementary treatment as well is never a bad idea when somebody has stubborn pigmentation and they've tried all other treatments as well. But I do agree with you. If it's not the first indication, you should probably treat it with the name product or medication for that condition. If it's melasma, sometimes you might need some
That's right.
hydroquinone, some actual, consultation with a dermatologist, especially, and even some good skincare with
Exactly.
melasma can certainly help. Now, a lot of our
Hmm.
patients have been asking about bioregenerative medicine. However, in Canada, there's only your PLLA, your Sculptra, and your Radia. So we're quite limited in terms of our products that we can actually use. So we're actually hoping that at some point, some of the products from Australia and Southeast Asia are going to start trickling over into our market. Have you heard since you are KOL, have you heard about maybe some of these products that might be going to North America or other parts of the world right now?
Uh, I thought Australia was the slowest country. So, I mean, yeah. Look, Australia for new products to come in, it's a slow process, but it's good and bad. It's good that
Yes.
we other countries experience
Yes.
all the side effects and they go through everything before we get the product. That's
Yes.
good, but we're falling behind. So I think Australia, Canada, I think it's a safe country. For those things to be coming in a bit later than other countries because
Yes.
of those reasons. But our clients are missing out on those new products. So
Yeah.
I actually don't know much about because America and North America it's a separate region for us as an Asian Pacific and European. We do a lot of conferences together.
Yes.
I think America and North America they're separate because their market is huge by themselves.
Absolutely.
So
Yeah.
I don't hear much about news about the Canada and US as an Australian doctor. So and FDA and those the governing bodies are very strict there. So I'm sure you will
Absolutely.
get it one day, but I
Absolutely.
can't tell you when.
No, I think it's great that the FDA, Health Canada, and even Australia is very strict. I know Australia is quite strict even in some of the social media rules and regulations on what you can advertise. It's quite particular, but I think it's also a very good thing. Even the government and the position of social media in general. I think Australia did have an idea at some point of banning social media for certain kids under the age of 14 or 16, something like that. So quite novel, quite
That's
interesting.
right.
And I think it's quite good that they are seeing certain dangers of social media. And one of the dangers that we do see from it that I find the Australians are doing quite well, is limiting it for certain individuals that don't necessarily need it. I think some of our younger population, since their brain is still developing, I think it's still a little bit young to make an informed decision on some of these treatments, especially when they're presented to you on a very
That's right.
fun, playful platform like TikTok Instagram or Facebook. It sometimes seems like a very
Mm.
harmless ad that does have some complications. So very important that a lot of our patients understand that these are still medical injectables. They are have a couple of risks, but it's very great to know that some of these risks, just like the product GURI, have very little side effects. Now, if there are any side effects, Dr. Han, what would you say the main side effects that you've noticed besides the nodules, for example, that patients need to be aware of?
Uh, so with the non-liquid form, the nodules and it's hard to correct what's already been formed, right?
Mm,
So those are the main thing. But with the GURI, because we don't have nodule, we don't have vascular obstruction. Only thing that with this possible side effect that you should aware of is from the overstimulation. So it's a swelling issue.
mm,
So swelling with the GURI, if you undiluted,
mm,
if you just inject a 1 ml undiluted product into your skin,
mm.
the swelling rate is around 5%. And it usually happens day 7 to day 10, and for a couple of days only. But if you put steroid on during that time when that immune response happens, the result decreases. So what the swelling I get is around 5%, and people don't usually require any steroid treatment to treat that.
Okay, good. Okay, good.
People actually
And
like
mhm.
it because they think it's baby fat for a couple diluted, 1 to 1 or 1 to 2, and the swelling disappears. So with the GURI, we're diluting it not to get rid of the nodules, but we're trying to get rid of the swelling.
I see. Yeah, very good. And do you give any particular post care for your patients to treat from the swelling? Do you give any ice packs? Do you give anything, or they just walk home with just basic recommendations?
They just go home without any steroid or antihistamine. Uh, but just in case, like 0.5% of cases, people get a little bit more swelling than the others. If the swelling is too much and if they want the swelling gone in a couple of days, I do put them on oral steroid for 3 to 4 days. But for normal,
Okay.
that 5% swelling rate, I actually don't put them on any steroid
Okay. Amazing. Now, one of the other questions that some patients
because it
might be
will
having.
compromise the
Oh,
result
so
as
sorry to
well.
cut you off, but one of the questions that some of the patients might be wondering is possible, maybe even allergic reaction. Now, we do know that botulinum toxin is quite rare to have an allergic reaction. Also, dermal fillers quite rare to have an allergic reaction unless you're allergic maybe to the lidocaine or the anesthetic that they put inside. Have you noticed any significant allergic reactions with any of your patients from these biostimulators?
So company actually recommends to put, so recommendation is to put antihistamine and some steroid. Um, but for me, for last 3 years, I never had to put them on any. And
Mhm.
still the swelling rate is 5%. There's no angioedema. So if that's what you're worried about, there's no angioedema.
Mm.
So there could be a day 7 to day 10 because GURI being a liquid stimulator, the process is actually faster than the non-liquid product. So that's why we get that 5% swelling rate between day 7 to day 10 for 2 to 3 days only. And it's very mild, so there's no need to put them on steroid unless it's really required.
Okay, perfect. So glad to know that the complication rate is quite low and that even if you do get a little bit of swelling, there's a small percentage of patients that are getting that swelling and it's not very significant. That doesn't generally require any medication and post care too much.
Yeah, for me, as long as there's no permanent side effects such as nodules or vascular obstructive event,
Mm,
I think the swelling is a minor issue for me because there's no prolonged or persistent swelling. It only lasts for a couple of days.
mhm.
So these are very mild issues compared to nodules and vascular obstruction.
Now, obviously, the question that some patients are going to be asking for you because it's an injectable, how painful is it? Are you using a needle? Are you using cannula? And in terms of, let's say, a scale of 1 to 10, where would you sort of place the level of pain for these?
It's a different, it is very, there's no way you can't feel any pain because even if we give lidocaine, uh, lidocaine still is painful, right? So people's gonna still feel one pain, whether the lidocaine
Absolutely.
pain is greater than GURI pain. GURI pain is slightly bigger. greater. So when I'm injecting Guri, I either premix or I do pre-lido before doing the Guri. So because people are used to lidocaine pain because they've been to dentists and they've all had, lidocaine injection into their teeth. So they know the pain. So they're quite comfortable with the lidocaine pain, but not the Guri pain because it's something new. It's much more stinging. So I'd rather have my client feel the lido pain from the lido than the Guri. But some people, after seeing some result, they don't really care. So they just go straight, sit on my bed and just inject Guru straight away.
Okay, yeah. And let's say because there's a lot of patients that
So
might
out
also.
of
Oh, sorry.
yeah.
Yeah, go ahead.
Hmm.
Go ahead, Dr. Yan.
No, it's okay. It's your turn.
Oh, so one of the thing that I was
Yeah.
going to say is that because pain is probably one of the big things that might turn some patients off when it comes to the treatment. I mean, lidocaine is great for a lot of the patients. They're probably going to be more used to it. Are there in Australia sometimes the use of nitrous oxide, these sort of like laughing gases, any other things that you use to make it a little bit more comfortable for your patients besides the mixing?
Oh yeah. Oh, definitely. My colleague in Vietnam, he uses Guri a lot, and apparently, Vietnam clients, they can't stand any sort of pain. So if they feel pain, he spends quite a long time prepping the client up with the Lido, and he injects very slowly, and he does anterograde injection with the Lido as well. Very slow. Yeah. So the rule is even if you're injecting Guri, if you inject slow enough, people feel much less pain as well. And some of the tips the Vietnam colleague he does anterograde very slow Lido injection before Guri as well.
And as an injector, this is more of a question between injectors. Which layer of the skin provides the most result, or which layer of the face are you injecting to provide the most result with Guri?
Okay, so Guri result can be divided into three result. Most superficial result. So if you want to get the number one most superficial result, it will be for the fine wrinkles, scars, and those result. In Korea, doctors combine Guri with the Mirajet or CureJet. Those jet machines to spray the Guri across your face. So we call it Guri shower, and that gives you the really most superficial result. But not so much of the deep tightening result, but more of the resurfacing result with the pores, fine wrinkles, and the scar result. Now, the next level is by using 34 gauge 2 mil needle and injecting the material into 1.3 to 1.5 mil depth. That gives you superficial result as well as a deeper tightening result. Now, if you inject the Guri using a cannula, which is the deepest layer, you can't be in a dermal. You can never be in a dermal layer with the cannula. So you're probably injecting into upper subcutaneous layer or on the lower side of the dermal layer, right? So if you use Guri using cannula in the subcutaneous area, the result is slight volumization result, probably due to it also stimulates some fat as well. So if you inject Guri cannula, you get slight volumization result and more of a lifting and tightening result. So there's two results that you need to look for: skin result and more deeper tightening result with the Guri. And I always tell, because this is a new product, if you want to compare the result, I actually compare with the monopolar RF result. So monopolar RF, if you do it, it's like a ironing, right? It feels like ironing. The March feels like ironing. Right? So by giving heat throughout the amount of collagenesis throughout the skin. So the result is being smoothing of your wrinkles. So I actually, if someone doesn't know what to look for in the Guri result, I tell them it's similar to monopolar result because that's what it's doing. We're producing collagen in different way. One is a different pathway, GORI by inflammation. But the result is similar, but the result with the collagen, injectable collagen stimulator GORI is much greater than one session of monopolar RF.
I see. So a little bit more effective, you would say, in building the result or building that collagen. Now, are there certain
That's right.
areas in the face, by the way, that you can't inject the GORI? Maybe around the eyes, maybe around the perioral area, or can you kind of inject it anywhere?
It can go over anywhere because it doesn't cause nodules.
Yeah. Yeah.
So most common area for nodule with the other product is the under eye area and orbital area because of the excessive muscle movement, and the product tends to get to concentrate, gets clumped up in those areas. So that's why we have a lot of issues injecting any collagen stimulator. I'm talking about the non-liquid versions using needles. Almost always, if you use needles with the powder form collagen stimulators, you have to be always careful with the more nodule formation. But with the GORI, there's no nodule formation, so I'm not really concerned even if I use the needles.
Now, in your past experience, because the one of the collagen stimulators that still exists here is the powder form Sculptra. We don't have any, unfortunately, injectable yet liquid biostimulator. What would be your tips for your injectors that just started off biostimulators to try and avoid nodules? Now, one of the ways that I sort of teach is make sure you dilute properly, make sure that before you inject the patient that you pre-mix it once again, because sometimes you'll leave it on the tray sitting and then you're just going to have a sediment onto it. What are your tips and tricks or your pearls to try and avoid and some of these issues that you have with the powdered biostimulators?
So I hear a lot of different ways that my colleagues do in Korea. Some doctors pre-mix it, like they mix it before 2 weeks before the procedure, and they keep mixing it. Even during the procedure, they mix it. I don't think that's. Yeah, so look, some products you can actually see the sediments forming as you inject, right? So that's the main difference. They form sediments, whereas GORI doesn't form sediment. Even if you leave it for hundreds of years, it doesn't form sediments. There's no real tip to it. So doctors who gets less nodules, obviously they dilute more, and the technique is also important too, and the layer dosability. So more even spread by more cannulation, more lines you do, the nodule formation decreases. So it is very injector dependent. And also the problem with the powder form's collagen stimulator is it has to be layer specific. If you go too deep, you're not going to see any skin result, right? So we have to go through every single layer, and we have to give you probably 10 to 20 lines. But more lines you give, less nodule formation. It's at the end of the day, it's all about the clumping of the tissues.
Absolutely.
Basically, my tip is to avoid area which is prone to have more nodule formation, diluted, more lines, more spreadability is the stimulators on the lateral area. Not try to avoid the inner area, because certainly we can achieve much more lifting result and tightening result and facial shape changing result by you making use of the lateral surface of your skin of your face. So if you try to avoid the inner face, dilute it, more lines. It's all about the spreadability. So there's no real solution to it, because some doctors have more nodule formation even if they dilute more. So it's all about technique and diluting more, I guess.
So I guess we're just going to have to wait and see until we get our first liquid biostimulator here in Canada, because if not, we might be
Yeah,
having
hopefully soon, because I heard the news, it will be approved in Korea within a few months. It's from the last 3 years. And because it's a new product, new material, actually people thought it will never get approved. But because Guri being used worldwide now with such a good safety profile, Korea KFDA is actually going to approve Guri in Korea within few months. So
Okay.
hopefully Canada
Mhm.
and US will follow.
Exactly. Generally, I would say we tend to follow a couple of years later, but I'm already happy that we have an injectable product that seems to be having less risk, less side effects, but at the same time being more effective for patients at the same time. So, quite exciting to see the world of bioregenerative medicine and injectables continue on growing. I'm actually very happy that we're moving away from all of the hyaluronic acid filler. Canada is very similar to the American market, but we're a little bit more conservative. So you would kind of make Canada and Australia quite similar. We were quite heavy still. Actually, we still are quite heavy on the botulinum toxin and the hyaluronic acid fillers. But I think most of the clinics now are already starting to switch very slowly over towards bioregen treatments. There's still a lot of
Mm,
regulation issues, things that you can say as well, even in the Canadian market, that you have to be careful of, because these are products that are still relatively new, and patients are just starting to getting to know about it. But as we're educating our patients here today, I'm sure some patients might be interested in opting towards biostimulators over some hyaluronic acid filler for the process of aging. Because as we know, the hyaluronic acid, it gives volume. It maybe treats one part of the aging, but it doesn't treat enough of that collagen stimulation. Now, I do have a final question for you, and this question might be a very
that's right.
interesting one. It's regarding facelifts and biostimulators. Now, as we know, some biostimulators get injected a little bit deeper. Some of them get injected
Hmm.
more superficially. Some of them get injected in
Hmm.
multiple layers, just as you've explained. A lot of injectors and some plastic surgeons had certain issues regarding certain injectables, especially when it was in the deeper layer. Now, have you had any
That's right.
colleagues, surgical colleagues, that have noticed anything regarding any patients that have received Guri so far?
Um, one of my good colleagues, Dr. Zachariah, is like a celebrity plastic surgeon in Sydney. He's combining his facelift surgery with the Guri. It's quite early on, so it's hard to say.
Too
So
early. Yeah, too early.
he plans to do some, been around for a couple of years. So I think more study needs to be done. But certainly, I almost always combine my thread lifting clients. I do a lot of reverse vector ponytail lifting and actually do Guri over this area, same area. And the result is out of the world because you get the initial lifting result, followed slowly by the collagen stimulating effect from the Guri, which holds the thread in together, which actually works synergistically. So your face actually gets smaller and better result over 2 to 3 months period. And the longevity, actually we increase the longevity by introducing the collagen stimulator into those area. So my most popular treatment at the moment, which my client love, is by combining the thread lifting with the collagen stimulator on the lateral surface where we put the threads. And that's actually making
Wow.
my, yes.
Wow. That sounds
So
extremely
please do
interesting
try, but
because
I haven't,
there's a brand new thread that just
yes.
came
So
into Canada.
so because, as you know, often once the PDOs or those PCL solid thread disintegrate, it doesn't cause huge neocologist effect. It's not, you don't see much of the tightening result from the physical collagen, physical thread lifting. So by combining these two, people are really happy because you get the Guri actually lacks initial lifting result. So we get initial lifting result with the thread, and using the same entry point that we already made from the thread, I just need to cover Guri on the lateral lifting area of the surface, and so lifting result followed by 2 to 3 months of more tightening result over this area, and that seems to be a winning formula in my clinic.
Wow, that seems to be very interesting because you're providing that lift and you're providing long lasting results at the same time. So, combination treatments still our winner till this day in
That's right.
2024 and still going to be in 2025, probably still in
Exactly.
2026 and years to come, I would say.
Of course.
And I'm very excited to start using
100%.
some threads. There are some threads that, like I was saying, there is a thread that just came into Canada. We're also very new on threads. I can probably talk to a whole other webinar and a podcast episode with you regarding threads, but our time is a little bit limited today. Very,
Sure.
very interesting talk with you, Dr. Paul Han. Thank you so much. Oh, thank you so much for joining us. Is it done?